Again. Well, you know that October is Breast Cancer Awareness Month, but did you know that an estimated 1 in 8 women will be diagnosed with breast cancer in their lifetime? Dr. Anthony Youn with Beaumont Health Systems joins us today about various options of breast reconstruction for women. So thank you so much for coming in.
Thank you for having me.
I mean, this is such a big topic, especially with Angelina Jolie having both of her breasts removed.
Exactly.
And I mean, she looks great. You couldn't even tell that she had her breasts reconstructed. So what are the options available for women today?
So surprisingly, only 23% of women know that breast reconstruction is an option directly after a mastectomy. And it's real important because studies show actually that the women's sense of self after mastectomy is better if they have reconstruction done immediately.
Oh, wow.
So
okay.
The easiest way to do it, and what most women do, is they use implants. And there are a couple of different implants that are possible. This is a traditional silicone implant.
And this is safer now because there was so much controversy around silicone breast implants, right?
Yes, and so that's the traditional one that's been used, and recently the FDA has approved what you may have heard of called the gummy bear implant traditionally.
So this is safer.
They both are, actually.
Okay.
So this is more of a higher cohesivity of a silicone. So it's almost like a solid silicone.
Okay.
So most women now who are having breast cancer reconstruction use an implant like this. There are other methods that we can use as well, methods that are a bit more involved, utilizing muscles to actually recreate the breast tissue. So we can use a back muscle, we can use a muscle from the tummy, and there are some even advanced operations where you're taking skin and just fat and transferring it to other parts of the body where you microsurgically, with a microscope, actually reconnect the blood vessels.
Now, women are always worried about how they're going to look. And as I said, Angelina Jolie looks perfectly fine. I mean, give us an idea of, you know, how natural does it look for women, or women shouldn't even worry about that at all?
No, I mean, it can make a huge difference in how women see themselves because, you know, these are parts of our body and parts of women's body that really create their sense of self. It is usually a multi-stage process, so it's not something where after surgery you wake up and you say, oh, look, I look just like before. There are always scars involved, and there are typically stages. You know, typically you rebuild it in multiple stages, not just one.
And it can be painful, but that subsides over time.
Yes, and insurances are mandated. They're required to pay for reconstruction of the breast and the opposite side, too, to make them match.
So bottom line, you should really talk this over with your doctor and
Yes.
decide what's best for you.
Definitely, and undergo the normal screening by the American Cancer Society.
Once a month?
Mammograms
once a
every year. Yep,
yes.
over 40, but breast self-exams every month.
Dr. Youn, thank you so much for your
Thank
medical
you.
expertise this afternoon. Brad, I'm going to send it over to you.